Okay, so I'm stunned this morning. I'm seeing Marianne, a former patient of mine. I can barely believe it because I remember her. Anyways, what was I talking about? Oh, yes, right. Thyroid. So low thyroid is associated with being heavy and tired. And very high levels of thyroid, people get nervous and thin. So when people are heavy and they see their doctor, and the doctor feels kind of at wit's end about how to help their patients, they will sometimes try to give their patients extra thyroid just for their low thyroid, with the idea that some extra thyroid medicine might be helpful. And so hundreds, thousands of doctors and patients on their own have tried it, and the disappointing thing is it doesn't work. It should work, but when you try to get enough thyroid on so that you can actually lose weight, you kind of flip out. You get tremors, your heart races, and terrible things happen. So we haven't been able to find that the use of thyroid medicine at slightly high doses help much. Now, apropos your Zetia, there's a new drug coming out to help your cholesterol, and it's a variation on thyroid hormone. So some extra thyroid hormone might, in the future, turn out to be somewhat helpful, but that's still in the research phase. But what you generally want to do is measure your TSH, which is your thyroid stimulating hormone, and cut back your oral tablets of thyroid after the surgery so you're not taking more than you really need. It may not be helpful, and it could be slightly risky. Okay, we got Januvia. That's for diabetes, so we want you to stop that, right? Post-op. And do you measure your sugar measure your blood sugar? Okay, for this week, would you please? Okay. It may only be a couple of days until you're cured of your diabetes, so.
Excellent.
Okay. And then you take Lotrel. That's for high blood pressure?
Yeah.
So we want you to stop that and get a wrist blood pressure cuff and measure your blood pressure 3 or 4 or 5 times a day. Okay, then you take the omeprazole. That's for reflux. We are going to give you that same thing, the omeprazole, to try and heal your stomach after the surgery.
Okay.
So you can just continue to take that.
Okay.
And Acto plus metformin. And so that's Actos plus metformin. And that's for diabetes. We want you to stop that. And measure your sugars with the hope, like, remember Cade, who was sitting over here yesterday? He was just about cured of his diabetes. He was on 4 or 5 medicines, including the Byetta. Do you know about Byetta?
I didn't know till I heard him talking about it. They've been trying to get me to get on that.
But do you know where Byetta comes from?
No.
Gila monster saliva.
Oh my God. No wonder it makes you sick.
Can you know those TV shows on PBS, you know, for World's Dirtiest Jobs? Can you imagine being out there as a Gila monster wrangler? Give me that saliva. So yeah, it's supposed to make you lose weight. Remember, he said it makes you nauseated, but just like the thyroid trick, the high thyroid should have helped you lose weight. It didn't work very well for you. His Byetta, even though it made him really nauseated, had an unpleasant feeling every day, he still didn't lose any weight. So no Byetta for you, you're lucky. And now I have once per week Crestor. Once per week, that's an odd dosage also.
Because I can't take the statins, but they were hoping that I could at least have it.
And what happens if you take the statins?
I would get really lethargic and tired. Just wouldn't feel good overall.
Okay.
It took a year for them to figure out. That's why I was feeling so crummy.
Okay. Well, so we want you to stop the Crestor. I'm still recording this? Was I talking about something? Oh, the thyroid. Okay. All right, so we're done.